Nutrition and physical activity. The school nurse, when available, is the most appropriate person in the school setting to provide care for a student with diabetes. However, many schools do not have full-time nurses. Even for schools that do, the nurse may not always be available at all times during the school day, during school-sponsored extracurricular activities, or field trips to assist with routine and emergency care. Trained school personnel must be available to perform and assist the student with diabetes care tasks. This presentation is not intended to provide legal or healthcare advice. Please consult with a legal or healthcare professional regarding your specific questions or needs. Each training component was created specifically for school nurses and other qualified healthcare professionals to train school personnel. This unit is Nutrition and Physical Activity. The objectives are for participants to be able to understand basic meal plans for students with diabetes, nutrition calculation methods, physical activity benefits for students with diabetes, and physical activity guidelines for students with diabetes. Why be concerned about nutrition? Good nutrition is important for everyone for optimal health. Nutrition is essential for growth and development, health, and well-being of all students and staff. Dietary factors are associated with 5 of the 10 leading causes of deaths, including coronary heart disease, some types of cancer, stroke, type 2 diabetes, and osteoporosis. Nationwide, we are facing an epidemic of overweight and obesity among children and adults. For people with diabetes, following a carefully designed meal plan is necessary to prevent both short and long-term complications by regulating blood glucose levels. Students who follow meal plan guidelines will be less apt to experience hyperglycemia or hypoglycemia and should have better attendance and participation. From a long-term perspective, following meal plan guidelines means that students can help to prevent or delay the onset of serious complications of diabetes, such as kidney disease, high blood pressure, heart disease, and blindness. While it is important for school personnel to be aware of the potential for those serious life-limiting or life-threatening complications, it is not appropriate for school personnel to discuss risk for complications with individual students. Good nutrition will help children and teens grow and develop properly and help to make them ready to learn. The student's parent, guardian, and healthcare team determine an individualized meal plan. A diagnosis of diabetes does not completely limit which foods a student can eat. Foods that were previously thought to be off limits can now be incorporated into meal plans for kids with diabetes. We now know that the same foods that are healthy for everyone are healthy for the person with diabetes. However, meals and snacks need to be carefully balanced with physical activity and medications. Eating consistent amounts of carbohydrate at scheduled times is important for children using a traditional insulin plan to match the effects of the peaking insulin. Children following a multiple-day insulin injection plan or using a pump have a bit more flexibility in the types of foods and timing than a child following a more traditional insulin plan. Students whose snacks and/or meals are delayed or skipped are at risk for hypoglycemia if they are using a traditional insulin plan. Children taking multiple daily injections or using an insulin pump do not usually require planned snacks, but would need to give insulin if unplanned snacks are consumed. Extra or ill-timed snacks and/or meals can lead to high blood glucose unless the child has a diabetes medical management plan. This DMMP specifies coverage with these extra foods. Timing is everything. One meal plan does not fit all. Each student's plan will vary according to the family culture, individual needs, and preferences. While establishing optimum blood glucose control is important, allowing students to have control over food choices and portions within the scope of their meal plans is important as well. The goal is to avoid creating any food conflicts or control issues and to allow for enjoyable meals and snacks. Some students with diabetes may need additional accommodations to help manage lipids, blood pressure, and weight. This is more common with type 2 diabetes. Many children with type 2 diabetes are on a nutrition plan designed to help them achieve a healthy weight. These students may be prescribed a calorie level target for the day, as well as consistent carb amounts to aim for at each meal and snack to help control their weight and blood glucose. Assuring that healthy foods such as whole grains, low-fat protein and dairy, fruits and vegetables are available is critical to their diabetes management. The management of type 1 diabetes has changed dramatically in the last decade, but the basic idea of balancing insulin or medications with carbohydrate intake has remained the same. More children than ever benefit from the flexibility in meal planning using the exchange or carbohydrate counting methods. These meal planning approaches are used successfully with traditional insulin plans, multiple daily insulin injections, or insulin pumps. The increased use of pen devices and pumps to deliver insulin has made on-the-spot insulin delivery easier and more precise. Additionally, the introduction of newer insulins has cut down on the need to snack just to avoid low blood glucose. Most students will dose their insulin before a meal or substantial snack. However, some who are picky or unpredictable eaters may dose after eating based on the actual amount of carbohydrate eaten. The timing of insulin dosing with respect to meals and snacks should be specified in the DMMP. Carbohydrate counting is based on the following from nutritional science. Calories in food come from 3 nutrient types: carbohydrate, protein, and fat. Each nutrient type affects blood glucose differently. Carbohydrate, which includes both sugar and starch, has the biggest effect on blood sugar. Approximately 90 to 100% of carbohydrates are converted into glucose in 1 to 2 hours. Proteins and fats do not affect the blood glucose level much. Therefore, they are not usually counted. Carbohydrates are found in several types of sources: natural sugars like fruit and milk, starches with fiber like raw vegetables, beans, and whole grains, starches without fiber like white flour products, refined grain products, and concentrated sugar like cake, candy, and regular soft drinks. The most advanced carbohydrate counting method allows the student to adjust his or her insulin depending on the amount of carbohydrate eaten at each meal or snack. The insulin to carb ratio can be defined as the amount of rapid or short-acting insulin that is needed to cover the blood glucose raising effect of carbohydrates that are consumed at the meal or snack. This will vary from student to student. It is determined by the student's healthcare team. The insulin to carb ratio should be included in the DMMP. The insulin to carb ratio is usually stated as a ratio of 1 unit of insulin to X grams of carbohydrate. It also may vary from meal to meal and snack to snack. The insulin to carb ratio method is used most often by students who are trying to maintain a tight control, students who use multiple daily injection insulin plans or insulin pumps, older or more independent students, students who are picky or unpredictable eaters. Students who use this method may administer insulin before, during, or after the meal per their DMMP. If students are administering insulin before the meal, it is particularly important that they know the menu and the nutritional value of menu items, whether the lunch is purchased at school or prepared at home. Here's an example of how to calculate insulin dose based on a meal with 60 grams of carbohydrate. If a student's insulin to carbohydrate ratio is 1 unit of insulin to 10 grams of carbohydrate and the total amount of carbohydrate eaten is 60, then we take that carbohydrate amount of 60 and divide it by the number of grams per unit from the carb ratio, or 10. So 60 divided by 10 equals 6 units of insulin. Some students will need assistance in the school lunchroom. Others will not. All students and their families should be provided with school menus and nutritional information in advance. If a staff member is assisting the student in making food choices, he or she also needs to be provided with the menu and nutritional information. Students should be provided with sufficient time for eating. The actual food intake of some students may need direct monitoring per the DMMP. These students may include younger or newly diagnosed students, picky eaters. Each student's level of independence should be respected. Per the DMMP, students should be encouraged to make independent choices to the extent that they can do so responsibly. Students who are independent in making food selections should not be subject to second guessing by staff or other students. The approximate carbohydrate content of school meals can be determined in advance by the school nutrition director and can be indicated on the school menu for each item. Provide the parent guardian with advance notice of parties and special events. If no advance notice has been given, contact the parent guardian once the event begins if there are any questions. Don't restrict unnecessarily. Follow the student's DMMP. Some students may prefer to bring their own food, but may eat what is available. Many traditional party foods are high in sugar and fat, so consider providing a selection of healthful foods and snacks to encourage healthy eating habits for all. Limit use of food as a reward. Provide parent guardians with advance notice of parties and special events. If no advance notice has been given, contact the parent guardian once the event begins if there are questions. Do not restrict unnecessarily. Follow the student's DMMP. Some students may prefer to bring their own foods, but may eat what is available. Many traditional party foods are high in sugar and fat, so consider providing a selection of healthful foods and snacks to encourage healthy eating habits for all. Limit use of food as reward. Physical activity is a critical part of diabetes management. Everyone can benefit from regular activity, but it is especially important for a student with diabetes. Students with diabetes should participate fully in physical education classes and team sports unless indicated by another healthcare condition, hypoglycemia, or high ketones as per the DMMP. In general, activity lowers blood glucose levels. Students with diabetes may need to make adjustments to insulin medications and food intake depending upon timing of activity to insulin peaks or meals and snacks. A quick acting source of glucose, glucose meter, and water should always be available. PE teachers and coaches must be familiar with symptoms of both high and low blood glucose and know what action they should take, including how to get help. If there is insufficient insulin, physical activity can raise blood glucose levels. Follow the DMMP for activity restrictions when ketones are present. Guidelines for activity and blood glucose monitoring include checking the blood sugar before, during, and after physical activity per the student's DMMP, especially when trying a new activity or a new sport. If the blood sugar starts to fall, the student should stop and have a snack. Students with pumps may disconnect or adjust the basal rate downward temporarily prior to physical activity per the DMMP. If students disconnect from the pump, they need to have a secure location to store the pump until reconnecting. The effects of activity can last up to 12 hours. Blood glucoses can trend downward for hours after physical activity.